Prepare the sling by gathering it in this way. Make sure the handles are on the outside of the sling and that they do not touch the patient. You'll be using these handles later to properly position the patient. Gently lean the patient forward, draping the sling across the shoulders. Place the leg straps inside the arms of the chair. Then tuck the base of the sling all the way down to the seat of the chair. The middle handle of the sling should be centered on the person's back, not skewed to one side or the other. This is the only correct position for the sling handles. Next, while holding the leg straps, reach into the corner between the patient and the sling. While gently but firmly pulling on the strap, slide the flat of your hand along the hip and down the thigh toward the knee. This draws the sling under the tailbone and hips. Repeat this procedure with the patient's other leg. Carefully lift the patient's leg. With your opposite hand, reach under the leg and gently draw the strap across the underside of the thigh. Repeat this procedure with the patient's other leg. Crisscross the straps by passing the yellow longest loop through the white shortest loop on the opposite leg strap. Notice that the white, blue, and yellow loops are of different lengths. Straps of different lengths provide two benefits. First, people who are larger, especially in the hips and legs, will require more of the strap. Secondly, you use the straps to change the position of the person you're lifting should that become necessary. There are three choices of loop lengths for the shoulders. The longest loops are yellow, the middle loops are blue, the shortest loops are white. Once the sling is properly positioned, you're ready to attach it to the lift. Bring the lift into place directly in front of the patient, opening the lift legs wider to accommodate the chair if necessary. Make sure the wheels are in the unlocked position. The lift should be a comfortable distance from the patient. Maintain this distance during the transfer to prevent the patient from feeling awkward or uncomfortable. The straps of the sling will be hooked onto the hanger bars of the lift. As we've talked about before, there are several loop lengths on the sling. The length of the loop you use determines the position of the patient during the lift. In most cases, a slight recline is the preferred position for the lift. To achieve a slightly reclined position, use the shortest or white loops to attach the shoulders of the sling to the forward hooks of the lift hanger as shown here. Then, attach the longest or yellow loops on the leg straps to the second set of hooks on the lift. If a greater recline is desired, simply use a longer set of loops at the shoulders like this. The longer the loop used at the shoulders, the greater the recline will be. Once the sling is securely attached to the lift, the hand control is used to engage the lift function. The lift button is marked with an up arrow and is used to raise the lift. The right button, marked with a down arrow, lowers the lift. As the patient is elevated, the lift will move slightly towards your patient. Check that the straps are positioned properly and not pinching the patient. Simply place your hand on the lift to gently guide its movement as it rises. During this movement, tension on the straps is created, so always double check to make sure the straps are correctly placed. As the boom rises above the patient's head, the forward motion of the lift will automatically stop with the patient in a stable and secure raised position. The ability to rotate the patient during the lift will vary depending upon the type of lift equipment used. With the Medcare lift, you can rotate the person at any time during the lift. You are now ready to complete the transfer of the patient from a chair to another destination. Common destinations would include a bed, a commode, or toilet. Remember to have the lift legs in a closed position prior to beginning your transfer. To lower the patient onto a bed, remember to press the down arrow on the hand control. Again, make sure the wheels are in an unlocked position unless you are on an incline or an uneven surface. As the patient makes contact with the bed, make sure that the patient's head isn't too close to the headboard. If necessary, provide support for the patient's head. Once the patient is positioned on the bed, disconnect the straps of the sling and push the lift out of the way. Next, gently roll the patient to one side and push the sling in close. Then roll the patient the other way. Carefully remove the sling.